Want to know the truth about Ozempic's jaw-dropping weight loss results? This one drug has transformed lives, but it's not a miracle cure. With 137 million Americans eligible for weight loss drugs in 2025, you need to know the real risks and rewards before you start. Stay tuned for the full scoop. Hey America! Ozempic has taken the weight loss world by storm, with before and after photos flooding social media and celebrities praising its effects. But what's the real story behind this diabetes drug turned weight loss sensation? With 42% of U.S. adults living with obesity, per a 2024 CDC report, and obesity costing $150 billion annually in healthcare, the stakes are high. And in this 2025 update, we're diving deep into Ozempic science, real-world results, side effects, costs, and whether it's right for you. Backed by the latest research, we'll share stories of Americans who've transformed their lives and the challenges they faced. From TikTok to doctors' offices, Ozempic is everywhere. But is it the answer to your weight loss goals? Let's find out. Ozempic, known generically as Semaglutide, was approved by the FDA in 2017 for type 2 diabetes. It's a weekly injection that mimics glucagon-like peptide 1, GLP-1, a hormone that regulates blood sugar and appetite. By activating GLP-1 receptors, Ozempic increases insulin, slows gastric emptying, and signals fullness to your brain, reducing hunger. A 2023 obesity study found that Ozempic users lost 5.9% of body weight in 3 months and 10.9% in 6 months, averaging 5 pounds per month at higher doses, 1 to 2 milligrams weekly. While Ozempic isn't FDA approved for weight loss, its sister drug, Wegovy, with higher semaglutide doses, 2.4 milligrams weekly, is. A 2021 New England Journal of Medicine study showed Wegovy users lost 15% of body weight in 68 weeks, about 30 to 50 pounds for a 200-pound person. Why does it work? It reduces food noise, those constant cravings, making smaller portions feel satisfying, per a 2024 Journal of Nutrition study. In the U.S., where 60% of adults consume high-calorie diets, per a 2024 USDA report, this appetite control is a game-changer. Key mechanisms: appetite suppression, reduces hunger by 20%, per a 2023 nutrient study. Slower digestion, keeps you full longer, cutting calorie intake by 500 to 700 daily. Blood sugar control, lowers A1C by 1 to 2%, vital for the 37 million Americans with diabetes, per the CDC. But it's not magic. A 2024 JAMA cardiology study estimates 137 million Americans are eligible for semaglutide, but results vary based on dose, starting weight, and lifestyle. Without diet and exercise, weight loss may stall, per a 2023 Women's Health study. Let's hear from real Americans. Pepper Schwartz, a 79-year-old from Washington, started Ozempic off-label in 2022. She lost 30 pounds, though she regained 5 after easing her discipline. Food feels less important, she says, noting smaller portions became her norm. Jamal Corona, who began Wegovy in 2021, lost 60 pounds, finding the drug curbed her appetite and even reduced her interest in alcohol. Gina Schwepp, with a history of gestational diabetes, lost 35 pounds in 3 months using Ozempic, paired with diet and exercise. The weight melted off, she says, regaining confidence. Emily Clausen, diagnosed with type 2 diabetes, went from 352.8 pounds to a healthier weight on Ozempic, then switched to Mounjaro, losing more despite insurance challenges. Janelle McCormick lost 60 pounds in 10 months on semaglutide, feeling better after just weeks. A 2024 obesity study showed average weight loss of 15 to 20% with semaglutide, but individual results vary. Some lose 10%, others 30%. Factors like starting weight, adherence, and lifestyle matter. A 2023 Women's Health study noted that higher doses, 1 to 2 milligrams, yield better results, but even low doses, 0.5 milligrams, reduce cravings. However, plateaus are common after 6 to 12 months, per a 2024 Medical News Today study, requiring diet or exercise tweaks. Ozempic isn't without challenges. Common side effects include nausea, diarrhea, vomiting, stomach pain, and constipation, affecting over 5% of users, per Novo Nordisk. A 2024 sustained Forte trial found gastrointestinal issues in 34% of users at 2 mg doses, versus 30.8% at 1 mg. Severe risks, though rare, include pancreatitis, 0.2% of users, gallstones, 2.6%, and potential thyroid cancer, per a 2024 The Conversation study. Ozempic face, where rapid weight loss causes facial sagging, is another concern, per a 2024 Harvard Health report. Gradual weight loss minimizes this, and plastic surgery can address severe cases. Overdose risks like severe hypoglycemia are rare but serious, especially with unapproved generics, per a 2025 FDA warning about counterfeit Ozempic. Celebrities like Amy Schumer reported nausea so severe she stopped Ozempic, while others, like Pepper Schwartz, experienced no side effects. A 2024 JAMA International Medicine study noted 52 to 55% of users stopped due to side effects or cost. Always consult a doctor and use state-licensed pharmacies to avoid fakes. Ozempic's cost is a major hurdle. A month's supply lists at $900, while Wegovy is $1,300, often not covered for weight loss, per a 2024 Today report. Some, like and from WebMD, found Canadian pharmacies offering Ozempic for $350 per month, but sourcing risks exist. A 2024 JAMA cardiology study estimates 129 million Americans qualify for Semaglutide for weight loss, but cost limits access. In November 2024, the Biden administration proposed Medicare and Medicaid coverage for weight loss drugs, potentially helping millions, per Today. Novo Nordisk is pushing for broader coverage, but for now, many pay out of pocket. Compounding pharmacies offer cheaper generics, but the FDA warns of safety risks. Tips to manage costs. Check insurance for diabetes-related coverage. Ozempic is often covered, unlike Wegovy. Use manufacturer savings cards from Novo Nordisk, reducing costs to $25.50/month for eligible patients. Explore patient assistance programs at novonordisk-us.com. Consult your doctor about switching to covered alternatives like Rybelsus, oral semaglutide. Ozempic requires lifelong commitment. Stop it, and you may regain most of the weight, per a 2023 Obesity Review study. A 2024 Medical News Today study noted plateaus after 6 to 12 months, requiring lifestyle changes to sustain results. Dr. Hans Schmidt from Hackensack University says, sustained weight loss needs diet and exercise, even with Ozempic. A 2023 obesity study found that physical activity preserves muscle mass, critical for metabolism, as GLP-1 drugs can cause muscle loss. Barbie Jackson-Williams, who lost 180 pounds, credits Ozempic plus workouts, like cross-training, for her success. Lifestyle tips. Diet. Focus on protein, e.g., chicken, fish, to preserve muscle, per a 2024 Healthline study. Aim for 1,200 to 1,500 calories daily. Exercise 30 minutes of cardio or strength training daily, reducing regain risk by 15%, per a 2023 obesity study. Behavioral changes. Address emotional eating with therapy, as Ozempic doesn't fix underlying habits, per a 2025 Within Health study. Monitor progress. Use apps like MyFitnessPal, popular in the US, to track calories, $50 per year. Ozempic can transform lives, but it's not a quick fix. Combine it with diet, exercise, and medical guidance for lasting results. With 42% of Americans battling obesity, your journey can inspire others. Talk to your doctor about Ozempic or Wegovy, check insurance, and start small with healthy habits. Share your story at obesityaction.org and join the movement for a healthier America. Subscribe to our channel for more daily health tips to keep you on track. That's the truth about Ozempic's weight loss results in 2025. From dramatic transformations to real challenges, you're now armed with the facts. Subscribe for more daily health tips and comment below. Are you considering Ozempic? Let's keep the conversation going and build a healthier America. See you tomorrow.